This is East Idaho Newsmakers with Nate Eaton.
Thanks for being with us here on East Idaho Newsmakers today. We are talking about an issue that affects a large majority of children here in the Idaho Falls area, at least if your child goes to District 91 schools. Chances are that they will be affected by the program we're going to talk about. It's called Stop the Bleed, and joining us here today, Margaret Wimborne, she's with District 91. Kristi Caldera is the ICU director at EIRMC, and Coleen Niemann is the marketing director at EIRMC as well. This program is called Stop the Bleed. There was a little bit of news coverage earlier this week about it, but Margaret, can you kind of explain to us what it is and what's being implemented in the schools?
Yes, the Stop the Bleed training is really part of the district's overall safety initiative. Our focus is really on creating safer schools. So we are constantly offering staff trainings, we do safety drills, and this is just one more component of our safety program to ensure that our staff are prepared for any emergency situation. We hope that they'll never have to use the Stop the Bleed training, but there are incidences where it could prove to be life-saving. So as we have sort of rolled out our safety trainings this year, each month the staff in our schools do safety training, and it could, the topics vary from evacuation drills to lockouts, lockdowns, those kinds of things. And then this is just incorporated into that training. And again, the focus is really on creating safer schools and being prepared for emergency situations.
And really, as far as implementing it district-wide, within the past few months?
Yes, we are really proud to have partnered with EIRMC with this training. It's really a safety initiative, and Kristi, I think, can talk a little bit more about that. But the goal is really to provide people with just quick and easy things that they can do that could save lives in an emergency situation to stop bleeding. So again, we have got sort of safety programs, safety trainings that we do every month in our schools, and so far all but one school has completed this Stop the Bleed training, and now we are moving into our support services like our bus drivers, child nutrition, and those kinds of things. Our goal is to really ensure that all staff district-wide have these, have this know-how.
How many staff members and teachers are in the district?
Gosh, we have probably more than 1,500 employees district-wide. That includes, substitutes and those kinds of things. But we have a lot of people in our schools.
So hopefully within the next few months, 1,500 more people in the community will know what to do in these emergency situations.
Yes.
So Kristi, from the ICU's perspective at EIRMC, you obviously would deal with somebody that has a traumatic bleeding incident once they get to the hospital. But how does having this in the schools help you from the medical end of things?
Well, so the reason why it's helpful for lay people to have it is because when you're bleeding, like literally that you could die bleeding to death, you might not have enough time for the ambulance to come get you. So that's why we're teaching lay people these skills. We're teaching them three things. We're teaching them, first off, to look and decide, is this life-threatening bleeding? And then what to do about it. So we're teaching them to hold pressure, to pack wounds, and to use tourniquets if they're appropriate. Just in that guideline of realizing that it's possible to bleed to death before the paramedics can come and help you.
And your staff is actually the ones doing the training.
Yes, so it's not just ICU nurses, there's ER nurses, there's trauma services nurses, and I've had actually physicians come and help me. This is something that EIRMC is really committed to. I've had lots of people help me get this out into the community. So last year we taught, not just in District 91, but we taught about 2,000 people last year Stop the Bleed in the community.
Just one thing I'd add is that while we have sort of partnered with EIRMC to provide this training to our staff, the goal is really to have everybody in the community have these skills. And maybe you can talk a little bit about just that it's really a nationwide initiative, not necessarily focused on schools per se.
So Stop the Bleed is a national initiative. It was started in October of 2015 with the goal of teaching every person in this country how to stop life-threatening bleeding. So that's why our goal is, to get it to everywhere. We started with the schools because it makes sense that that's a high-risk area. We see that in the news. We know that that's, school shootings happen, terrible things happen. So we wanted to make sure and start there. But really, we're willing to teach church groups, businesses, anybody who wants this training, we want to give it to them.
And it sounds pretty simple as far as the training is concerned, but yet could make a big difference. Just the other day there was a shooting at a mall in Salt Lake City, and there was cell phone video. I don't know if you guys saw it, where two of the victims actually, somebody walked up to them and was videotaping them with their phone, and I noticed someone pulled out a belt. I think the guy was shot in the leg, or if I recall. Anyway, I could see them putting the belt on, trying to stop the bleed as blood is dripping on the sidewalk there. And it's sad that this is I was not shocked by the video because we may have become so used to these situations. But Coleen, there at EIRMC, this is kind of a big initiative, isn't it? Trying to take it out to the community and educate as many people as you can.
Well, as Kristi mentioned, we have been involved in this initiative for several years, but this really represents the first organized effort, a first partnership with another institution as large as District 91. And so we were really pleased to be able to provide that training for staff members. As Kristi mentioned, everyone's concerned about injuries in schools, but in addition to a worst case scenario, this is really useful for accidents and injuries. You know, I was speaking with one of the participants in the training yesterday, and she was talking about a high school student who was playing basketball at the school and went up and hit his head on a beam and started bleeding. So you could imagine scenarios where playground accidents might cause bleeding injuries, shop class, falling on ice or anything like that. So we see this can be used in a lot of different ways, and that's really why Kristi's goal is to teach anyone who is interested in this.
And I know there's going to be people watching now that say, well, I want to sign up for our class, or I want to have EIRMC come to my place of business. Can they do that? I mean, you could spend all day probably going everywhere teaching everybody, but how does that work?
So our vision over the next year is to do just that, but we obviously have to do it in a way that handles Kristi's time and our nurses' resources and things like that. So we have almost completed training with District 91. We are starting with District 93 and to essentially do the same comprehensive training with their personnel. And then we do want to go into churches and businesses and city organizations and things like that. What we would ask is people who are interested reach out to Kristi at the hospital if they have a business or an association that we can train in groups of 25 or more.
So what we can do is we can put a link or contact information down below this video if you are interested in that, about who to reach out to and how to get to them. Kristi, a few years ago I was out covering a story at an apartment complex, and all of a sudden a man on his ATV drives up and he is bleeding profusely from the head. He had crashed into a tree and he had part of a twig in his eye, and I froze. I didn't know what to do. I called 911, but I didn't know whether to touch the guy, and my camera guy was there, and it was kind of like, what do we do here? And I think that a lot of people get in that situation and they might freeze like I did. What's your recommendation? What should I have done, or what should we do if we encounter situations like that?
Well, so the first thing I want to tell you is you did the right thing first. You called 911. That's always the first step, because even if you've had this training, like, we are not teaching you how to long-term take care of any kind of these injuries. You need help, which is why you call 911. And then the next thing that you're going to do is you're going to look for life-threatening bleeding. Now, I wasn't here, so I don't know, like, was it life-threatening? Was it a lot? Obviously, blood always looks like more than...
He was talking and communicating.
Right, so he was doing okay. So then what you would do is you would hold pressure. So we teach people, like, literally you're going to use the best thing that you have in the situation you find yourself in. Because obviously we're all going around living our lives without our first aid kits, right? Like, we're here, we're doing whatever, so you use the best thing you can. So literally, if you were in a situation where it was life-threatening bleeding, then it would be clean cloth. What are you willing to take off, yourself or him? Do you have a t-shirt on? Will you take it off? Do you have a jacket? Like, what can you use? And then you're going to hold direct pressure. So direct pressure is something we teach people to do with both their hands, and the way you know how you're holding enough pressure is if the bleeding stops. So if you were doing that and you could control the bleeding with just pressure, you would just hold pressure until EMS came. If you couldn't quite control the bleeding, then you could look at packing the wound, which would be where you're actually putting if you were using, like I gave the example of your t-shirt, or if you had a first aid kit and you had gauze, like whatever the best thing you have is, you're going to use that, pack it in the wound and hold pressure on top. And then for specific wounds, if you had them available, a tourniquet is appropriate. So those are just wounds on our arms and our legs. But the reason we get in trouble with big wounds on our arms or our legs is because there's huge arteries and veins that run along our long bones. So you can, for example, be in a car accident and get a compound fracture. That means that the bone broke and went through the skin. And that broken bone can actually lacerate those arteries and veins. And so in situations like that, like you can literally bleed to death from a broken leg. Like really that's what's killing you. Well, what's killing you is that you're bleeding, but you know, it's from a broken leg. So in those scenarios when the wounds are on the arms or the legs, then it's appropriate to use a tourniquet if you have one. And I want to make, you referenced the video, the mall shooting with the belt. Yeah. So in this scenario, what I want everybody to know is you're going to do the best with what you got. If you got a belt, that's what you want to do. But part of the Stop the Bleed initiative is that tourniquets go up in public places. They're actually making kits to go on walls in malls and schools and churches, just like AEDs. They're in a plexiglass box. They have kits with gloves and tourniquets and gauze in them for emergencies like that. And that's part of the Stop the Bleed initiative, that they're nationally advocating for those things to be available in public places.
That's another part of our partnership, and we're very grateful to EIRMC because they've donated Stop the Bleed kits for every classroom in the district, as well as extra kits for common spaces, as well as several tourniquets for each school. So there's quite an investment there, and we really appreciate that, because the first thing is sort of knowing what to do in those situations, but the other thing is just having some of these basic supplies in order to you know, stop the bleed.
And if you know that there's a kid on the wall that has gloves, has a tourniquet, has what I need, rather than scrambling for a towel or whatever. Mm-hmm. Has the thinking changed with tourniquets versus 10, 15 years ago? Because yes. I think I remember learning tourniquets could kill you and never use a tourniquet, but if we're putting them in classrooms, things may have changed or evolved.
And they totally have, and I think one of the big things that led to that, so in trauma, like most of what we know about trauma, we know from the research that the military does. So prior to 2008, in the conflict in Afghanistan and Iraq, the incidence of death from non-lethal wounds in our soldiers was like 24%. So about 1 in 4 of them were dying from a wound that they bled to death from. The military made a change in 2008 where all the soldiers, they carry tourniquets on their person, one for themselves, one for a body. And then the last reported statistic of that same incidence of death from a non-lethal wound is 3%. And the reason why is because literally it can just take minutes for somebody to bleed to death before you can get help. And the other thing that happens is you always have to think about this. So our blood all the time has all the things we need to stop bleeding. But when we're bleeding a lot, like we're also bleeding out all the things we need to stop bleeding. So lots of times we want to think about, like, I'm bleeding out, like my red cells. People always want to talk about the red cells, right? Because they're important, they're what carries our oxygen. But in point of fact, you're also bleeding out all the things to help you stop bleeding. So the longer you bleed, the harder it is to stop it, which is why it's really important for people to be brave and do their best to control that bleeding while they're waiting for help to come.
Coleen, what's been the response of the teachers and the staff?
We've had great response from our teachers. Again, we hope that they will never have to use this in sort of a crisis situation. But there are lots of incidences, like Coleen said, that happen, every day in the school, accidents on playgrounds, those kinds of things. And it's just sort of basic common sense things that you can do that can really make a difference. So we've had really good response from our teachers and staff. They really appreciate sort of having that information and sort of those tips and suggestions. And Kristi has done the bulk of the training, as well as her staff. I mean, they've just done a fabulous job. We're really, really glad that they've been able to provide that service.
It's interesting
provide that training.
And I'm sure most of them, if they've been teaching a long time, 15, 20 years ago, lockdown drills probably weren't a thing. Stop the bleed wasn't really a thing. Shelter in place, those type of things have changed so much. And I guess it is commendable that we are doing these in the schools where most of our children are every day.
And again, I mean, this is one part of our sort of comprehensive focus on safety across the district, providing these trainings, trying to make sure that our staff are ready for different emergency situations. And some of them are pretty run-of-the-mill, but there is the chance that something more of a sort of a critical emergency could happen, and we just want to be ready for that. So it is part of sort of creating schools, but again, I'd say that it's sort of bigger than that. It's also about creating a safer community, making sure that everyone has got these skills, because there's lots of, especially in this area, car accidents, hiking accidents, those kinds of things. And again, I think that we can really create not only safer schools, but a safer community.
Coleen, about a year or two ago, we did a tour, behind the scenes tour of the ICU and the emergency room at EIRMC, and it was fascinating from the media's perspective to see that. Let's say, heaven forbid this never happens, but let's say there is a mass trauma at one of the schools, a shooting, or where multiple people have to go to EIRMC, the only ER here in the Idaho Falls area. What happens on your end? What happens on the hospital if you've got 10, 15 kids coming in that have been shot?
Sure. Well, it is a very orchestrated procedure when we declare what we call a Code 66, which is essentially a disaster scenario. And I will say, first of all, we practice the disaster scenario 2 to 3 times a year, not only in our building, but often with partners like the Idaho Falls Police Department or Fire Department and things like that. So everyone has a role, and because we practice, we know what that role is. Obviously, the first is the communication comes from the field. Idaho Falls Fire Department is responding with their paramedic units, and law enforcement is responding. And they're communicating with us before the first patient even comes to the facility. So we start implementing our processes in a disaster situation. That would include initiating an incident command center. So we begin to immediately review how many beds are available in our facility, how many nurses and other staff are available to be redeployed from their current role, perhaps to a support role in the ER, or how many nurses and staff can we immediately get on the phone with and call into the building. So we begin to immediately understand what resources are available and how we can redeploy them to maintain continuity of care for current patients, but then handle an influx. And then that process evolves over time. So, Kristi can tell you that the ER handles, as a level 2 trauma center, last year we had 1,500 trauma activations, again declared by the paramedics who respond. And so it would not be unusual to have major traumas coming into our building. We have them every day. But certainly when we have a situation that would strain our resources, such as 10 traumas at one time, then that's when we institute those protocols I described.
And from what I recall touring the ER, you even have the option to create additional patient triage centers, right? I mean, you might not use every day, but if it's a mass trauma, you can turn this room into another ER sort of room.
You're absolutely right. And in fact, the preparations for last year's eclipse was actually where we really understood how would we make a hallway a triage area. How would we designate rooms for low-level injury all the way up to the most critical injury? So we really have all of those systems in place. We already even have those areas in the computer. They're sort of turned off in normal operations, but if they had to be turned on, we could know that space in that hallway is number 42, and it's set up in the computer system already, so we could immediately begin clinical care. So that's something I'm really proud of, is our emergency management protocols, because we spend a lot of time and effort, and they, in many ways, our clinical staff does that in a small version every day with those traumas, when those trauma codes are called. But in a mass disaster situation, I feel like we are ready with the systems in place to obtain the resources we would need immediately.
And let's hope we never have to try that.
That's right.
Just the drills.
Indeed.
Kristi, what do you say to the people watching right now that say, all right, I don't have time to go to a class, or I don't have a tourniquet on my wall at home, but what can the average mom and dad at home watching right now do in case there's something that happens at home, or they're at the grocery store and they see something?
So there's a really good online resource, bleedingcontrol.org. It's the American College of Surgeons website, and it's going to talk about every step of what the Stop the Bleed initiative is. And truthfully, if you really wanted to take a class, it literally takes an hour. Like, we just need an hour of your time and a venue to get you there. So if you could figure out when that was, we would do our best to get you a class. So if that's through your church or your work or whatever, like.
And is it free?
It's free.
Okay.
Yep. Really what I need is a room that has AV equipment and some tables and some people to teach.
All right, well, thank you very much, ladies, for coming in. The program is Stop the Bleed. We'll link to some resources, that website that you mentioned, along with some contact information if you want to get in touch with EIRMC, also some previous stories about Stop the Bleed. And will children know about this? Are the students going to be aware about this?
The student, it wouldn't really impact the student, you know, unless there, you know, was some kind of a situation, and then our staff would be able to put these skills in use. It's really one more thing that we kind of do behind the scenes to you know, to make sure that our schools, that we're creating, you know, safer schools.
Yeah.
And one thing I would like to mention, just for parents, I know that there are lots of headlines that are a little bit scary, and you know, with shootings not just in schools but theaters and malls, it can be kind of a scary world sometimes. And EIRMC and the district has also partnered on a number of community workshops that kind of focus on mental health issues, and we're doing one on the 23rd of January at Taylorview that really focuses on how to talk to your child when the world seems a little bit scary. EIRMC is going to have a guest speaker who will kind of help parents kind of figure out what to say, when to say it, you know, how to say it, and then we'll have our counselors. We have a crisis team that kind of moves into schools when there are situations where students are struggling, whether it's a student death or an accident or some of those kinds of things. So talk a little bit more about what the district has in place in those situations. But we'd love to have you know, parents, community members, grandparents come to that session, because again, there are, you know, some really helpful tips and suggestions, and it can be really difficult when those situations happen to try and sort of figure out what you think about it, but then also how do you talk to your child and make sure that they still feel safe. So I would encourage folks to come out on the 23rd for that workshop.
23rd, we'll include information to that. And the fact of the matter is that you'll probably maybe need that information more than the Stop the Bleed in a way. Thank you very much, Margaret Wimborne. She is with District 91. Also, Kristi Caldera is the ICU Director at EIRMC, and Coleen Niemann, she is the Director of Marketing at the hospital. And thank you for watching. Have a good week.